Hello, my name is Heather Gaydos, and I am the Reentry Project Director at the Center for Prisoner Health and Human Rights in Providence, Rhode Island. On both a personal and professional level, I deeply value the dignity and worth of every person, and I strive to effect individual and systems change that shares and embraces these same values. After 16 years of working at community-based organizations in Providence, Rhode Island, I began exploring the gaps between Rhode Island's criminal justice system, justice-involved individuals and families that I had been working with, and community providers who serve these populations. As a means to address some of these gaps, I am now coordinating and leading a new initiative called the Rhode Island Reentry Collaborative. This collaborative is a community-based initiative designed to help address the gaps in services for people exiting prison and returning to their communities. Rhode Island is such a small state that all of our communities and services are within 1 hour of each other. So there's absolutely no reason why we can't and shouldn't be a national model for how statewide reentry can effectively work to provide a continuity of care for this population. Throughout my career working at community-based nonprofits, I spent a lot of time with what felt like running around with my head cut off because there's no system to plug into. There's no collaboration in place to know if the client that I was working with was also working with and receiving services from the organization down the street. And there's no place to turn to for knowledge and understanding about how to best advocate for our clients within the criminal justice system. So the formation of the Rhode Island Reentry Collaborative is not necessarily about creating new programs or services, but about building upon those that already exist and creating a mechanism for them to work together in partnership with the Rhode Island Department of Corrections in a better, smarter, and more effective way. The goals of the Reentry Collaborative are to improve the quality of life and supports available for the reentering population, to build a collaborative, community-based approach to case management that meets the comprehensive needs of justice-involved people, and to increase the community capacity of the community providers that are working with this population to offer services that are evidence-based and proven best practices for this population. And hopefully, if we do all of these things, then we have also reduced recidivism. I believe that health equity will really truly exist in Rhode Island when justice-involved individuals and their families are systemically afforded opportunities to live economically viable and healthy lives. This requires a community that is willing to confront its biases and inequities, recognize the interconnectedness of the health and success of all individuals, and directly address the collateral consequences of a criminal record. Hopefully, the formation of the Rhode Island Reentry Collaborative has moved us closer to accomplishing this. Thank you.